Hi, this is Dr. Randy Hurst, a clinical psychologist you've heard this before hopefully, doing some basic information videos. This one is kind of an introduction about sleep. I won't be talking on this one about how to make sleep better, but just some basics that become very important for people understanding some of the problems they might have with sleep, especially later in the night. So I'm going to introduce this a little bit. I won't be getting into technical details. For example, there are 5 stages of sleep, or some say 4 stages plus REM sleep, which people think of as primarily dreaming, but rapid eye movement sleep. We see it in our dogs and cats. We have it as well. So early in the night, the REM sleep is shorter, but the deep sleep is longer. And then through the night, in an average person, the REM sleep gets longer and is the very longest at the end of the night, whereas the deep sleep is less so. And then there's the kind of in-betweens. But if you're interested in that, read more about that in another place. Otherwise, it would get too long. Anyhow, there's cycles. That's the important thing, is that you go through 1, 2, 3, 4 REM, 1, 2, 3, 4 REM, and each cycle lasts on average 90 minutes, about an hour and a half, maybe more. And one of the ways to find out, in your case, is kind of note when you go to bed, and then if you get up, say you get up in the middle of the night to go to the bathroom or something, or you've got some pain issues and the pain wakes you up. Note what time it is. And if you've had 2 cycles, it should be 3 hours later. If you've had 3, it should be about 4.5, roughly, hours later. But you can get a sense of what your personal cycle is, because it's usually fairly steady within the individual. On average, they recommend that we get about 5 cycles to get a full night's sleep, and the impact of getting 5 full cycles is there's improved health, reduced stress levels, reduced pain levels. And oddly, or maybe not odd, but recently I'm reading research saying that there's indications that their good sleep, or poor sleep, let's say, is connected to dementia, risk of dementia developing. But in general, you feel more rested, and you've got enough storage of resources built up during the sleep process. We don't know exactly what all happens. They believe, if you've heard about, for dementia, for Alzheimer's, these beta amyloids, these proteins that are kind of sludge proteins in the brain, that getting a full night's sleep will help resolve or drain out or in some way process those, that if a person has very poor sleep, that process doesn't get to happen, so the buildup gets worse, which then increases the damage to the brain. Also, reduced sleep increases risk of depression, and then just general fatigue during the day. So, important implications are getting full cycles and getting about 5 in a night. One of the things that I happened to run across, one of the interests that I developed in this, was because I would get up in the middle of the night and found just what I mentioned, that it always happened at either 3 or 4.5 or maybe 6 hours. And I thought, that's just weird. So I got a book out of the library, read about it, and found out about the sleep cycles and how consistent they are. And so in reading about that, I also found that at the end of the cycle, we're the most awake of any time before we start down into deep sleep again. And so it dawned on me that if that's what allows me to wake up because I'm realizing I need to go to the bathroom, I'm not realizing that anywhere else in that hour and a half. But I've had some problems with gout occasionally when I get dehydrated when I'm traveling or something like that, rich foods, maybe alcohol. But found out that the same thing happened. I would wake up in terrible pain sometimes when my foot is just swollen and red. And before I really knew what was going on and found a medicine that could work. Anyhow, it always happened at the same end of a cycle. And then I would talk to patients and find that often their worry or their pain or their stress would wake them up. But again, I had them track. Okay, what time did you wake up? Did you notice the clock? And if they didn't know, have them start tracking it. And almost always, it was on the end of a cycle. And I said, look, and I especially found this with my own pain issues, is that I had the best pain management of the entire day during the sleep time. It was just at the end of the cycle that I would wake up and be in pain. But it was easy for myself and for patients to believe that their pain woke them up. Well, kind of it did, but it's because they're essentially awake anyway. They're just on the hairy edge of being awake before they slide back in. But if they said, oh, my worry, my stress woke me up, and I couldn't get back to sleep. That's partly, I started having them understand this sleep cycle, and that no, the stress didn't wake them up, that it was the cycle. If they could allow themselves to slide back in. We'll talk about some of the skills for that later. But if they could allow themselves to let go or to write a couple things down, I have talked about that in another video, they could slide back in, not quickly, probably early on, because they've got no experience. Their experience is waking up and stressing all the rest of the night sometimes. They found that they often could slide back in and maybe wake up another hour and a half or 3 hours later, but get closer to a full night's sleep, have that time that they're awake smaller, which allowed them to have more rested sleep and stay within the regular cycles to the extent possible. And they just, in getting better sleep, they felt better. They were less stressed. They had now more of a sense of ability to do something about the problem that they may have had for a long time, where they felt like they had this, we call it terminal insomnia, to wake up in the middle of the night and not be able to get to sleep again, and find that they could. That by itself was huge. So, same for pain patients. Helping them know that they could slide back in. Wonderful. Try this. Look and see if you are waking up on a schedule. Now, one proviso, one real important piece here, is if you are waking up in the middle, especially if you're waking up real kind of startled suddenly. If your sleep partner is saying you weren't breathing, or you were snoring really loudly, or you wake up just almost in a panic or afraid of something. I had a client who was having real bad dreams. Well, remember that dream cycle is right at the end of the 5 stages, and he would have these very bad dreams about kind of a dark presence that was very menacing. And he had decided that it was some remembering of sexual molestation when he was a child. And it's the only thing that made sense to him. Well, and it took a long time for us to figure out, because he wasn't sleeping with anybody that could give him feedback. And I wasn't thinking of it so much at the time, but he described a couple things that made me go, wait wait a minute. And I had him time the cycles and what time he would wake up. And clearly he was waking up in the middle of deep sleep. I would tell you, if you find that you wake up with this gaspy, panicky, stressed kind of feeling, if you're very tired the next day, go see your doctor and describe what's happening. The doctor may recommend a sleep study, and they may find that you have sleep apnea. There's two kinds: central sleep apnea, where something's happening in the brain that is throwing the rhythm off, so to speak, and waking you up or stopping your breathing. But the most common kind is called obstructive sleep apnea, where often body size, being heavy, thick neck, can set up for stopping breathing, for getting in the way of breathing. And that's why people will snore loudly, or that's why they'll literally stop breathing. And this can happen many times in the night. Usually it starts back up again because the body recognizes, I am not getting oxygen. And that's part of what can cause the bad dreams. Buildup of carbon dioxide that sends the body into a bad place that wakes you up, and where some of the fear and the fight or flightish kind of reaction happens. That's really important to deal with, to take care of, because, well, one, because we need oxygen for our brain to function. So there really can be small levels of brain damage that accumulate over time. So please, if you have any of those kinds of symptoms, waking up in the middle of cycles with that startled reaction, see your doctor. And do the treatment that they talk about. It's a wonder. It will help your concentration, your memory, it's your energy level. It'll reduce depression. It'll reduce the weight gain that comes with apnea. So please, check that out. The other little weird thing that happens that I only run across a few times, but it's so distressing when it happens. During the REM sleep, the dreaming cycle, if you remember your dreams, you may remember times of walking or running or flying or doing things, skiing, something physical, something active. Well, that's kind of all those messages of doing those things are really happening in the brain. And so one of the pieces of REM sleep is that we're paralyzed in that time. The body gets paralyzed, so the brain can do all of the flowing and reacting as if we are doing the walking or running or biking or whatever. So that paralysis every once in a while in some people can continue after they wake up. And this sleep paralysis can scare the crap out of people. And it goes away very quickly, usually within 30 seconds to a minute. But in that time, it can be so freaky if you don't understand it. That I had a kid when I was in high school who absolutely, it just freaked him out. Knowing it doesn't make you less paralyzed, but knowing it may let you kind of take a deep breath, slow down, just wait for a few seconds and have it come out. Talk to the doctor again. There may be something they can do with that. I think there's a medication, but I don't remember what it is. The question to ask, will this affect the quality of my sleep? So check those out. Think about the stages. Think about that hour and a half, roughly, time schedule, and check your own timing to see if that works. And check out the videos that I'll have up soon about how to help yourself get back to sleep. Or go to the diaphragmatic breathing video that I'm sure is on there already, and see if you can't use that to just help settle. Okay, thank you, and keep coming back.